We're all in this together, and we all pay the price when we treat people like they don't matter. And so we are paying the price for years and years and years of disinvestment in the American people.
That's the voice of Liz Watson, Executive Director of the Congressional Progressive Caucus Center. She's today's guest on Press the Button, a Plowshares Fund podcast dedicated to nuclear policy and national security. But first, here are your co-hosts, Joe Cirincione and Michelle Dover.
Good morning and welcome back to Press the Button. Today is our 51st episode, almost a year old. I'm Joe Cirincione and I'm doing the episode solo this week. Our usually exuberant host, Michelle Dover, is out sick, and we hope very much that she'll be back with us next week. In the meantime, the Plowshares Fund offices remain closed, but we're working hard to bring you these episodes from our home. I now have a studio set up in my home here in beautiful Tacoma Park, where it's a gorgeous, sunny end of March day. I hope you're well. I hope you're safe. And I hope that we can make Press the Button more relevant to what we're all going through right now, which is why we're starting off our early warning segment with a focus on the coronavirus and how it's impacting us. Tom Collina, our proud Plowshares Fund Director of Policy, will be hosting early warning instead of Michelle this week. And you'll hear him talk to Jean-Carl Baker, our program officer who specializes on North Korea. He has a new article out in the National Interest, and he will examine how the U.S. sanctions are impacting the pandemic efforts in North Korea and in Iran. U.S. sanctions are so harsh that they're actually blocking the ability of these countries to get needed medicine and medical equipment. We're also going to talk to Cecili Thompson-Williams about how her grassroots organizing group, Beyond the Bomb, is balancing their campaign to change U.S. nuclear policy in this time of pandemic. If you're an organizer and you're working on a critical issue, what do you do now? Well, stay tuned and you'll find out. After that, I have a terrific interview with the dynamic Liz Watson. She's the Executive Director of the Progressive Caucus Center. She'll help us understand what just happened last week with this massive $2 trillion economic relief bill. What was in it that will actually help us survive this pandemic? How much of it was corporate giveaways? And what happens next? Is there going to be another package? And will this crisis impact national security spending? Might Congress finally reprogram some of the $750 billion it's set to give the Pentagon and spend that money instead on critical domestic programs and economic relief that our nation needs now? How realistic is that hope? And during these times, we're going to continue to record remotely in order to keep you up to date on the latest developments in national security and foreign policy and the pandemic. We're asking you to stay healthy, stay indoors, and stay tuned. If you like what we're saying, please tell a friend. Have them listen to what we're saying. Have them spread the word. And please, leave us a comment or a rating. And you can always reach out to us on Twitter. We are @PressButtonPod. We'll be back next week to celebrate the one-year anniversary of Press the Button with you. But right now, the clock is ticking.
And now, early warning, early warning, early warning, early warning. A 7-minute synopsis of this week's nuclear news.
Thank you, Del. This is Tom Collina, Director of Policy at Plowshares Fund. And today I'm joined by Cecili Thompson-Williams, Executive Director of Beyond the Bomb, and John Carl Baker. He's the Nuclear Field Coordinator and Senior Program Director here at Plowshares Fund. Thank you both for joining us. We have 7 minutes to cover this week's national security and nuclear news, and our time starts now. Well, big sigh of relief now that President Trump has backed away from his plans to prioritize the economy over public health by reopening the country by Easter. I never thought I'd be so happy to face another month of social distancing, yet here we are. So today, we will talk about how this crisis is affecting U.S. policy, both domestic and foreign. And Cecili, we'll start with you. Beyond the Bomb, for our listeners' sake, is a national campaign where you're trying to educate Americans primarily about the dangers of nuclear weapons and solutions to nuclear threats. If you could tell us how the coronavirus crisis is affecting your work in terms of new messaging you're using or new organizing activities you're trying out. Thank you.
Absolutely. Thank you for having me. So with any crisis, but especially a global crisis of this magnitude, we start with a strategic review and deep analysis. So we started by exploring some key questions. Where do our policies currently stand? What are policymakers doing now? What should they be doing? What shouldn't they be doing? And will this impact our long-term theory of change? From that, we established 4 essential pathways forward approaches to our work. The first was ground our work in our values. So we're constantly asking, why are we doing this? And what does this mean? What does those values mean in the context of this crisis? The second is to be vigilant. Mr. Rogers taught us that we should look for helpers during a crisis. Unfortunately, the flip side of that is also true. We need to look for the disingenuous opportunists. So we started Bullshit Watch, which is an opportunity for us to provide a home base to keep track of attempts to covertly pass bad policy while the world is distracted by COVID-19. Be collaborative is our third key approach. So this is something that we've been doing for a long time, but putting those first 2 approaches together of grounding our work in values and being vigilant, this reinforces our commitment to partnership. And so this is a great time to really look for opportunities to build partnership, identify unlikely allies with common aims and targets and values, and do the hard work of standing together in solidarity. And then fourth, remembering our people. So our community of activists and staff, Bomb Squad, are an incredible group of people from across the country, and they're real people living real lives in a country that's experiencing a real crisis. And we're not therapists or crisis management experts, and we definitely don't pretend to be, but we are people who can relate to others as human beings, not just email addresses. So we take all those pieces together.
Great. And one thing I've seen you all doing, which is fascinating, is looking at the budget trade-offs here, right? If we're spending so much money on nuclear weapons, can we be spending enough or all we need to spend on COVID-19? Can you talk about that a little bit?
Absolutely. From an issue perspective, we recognize that the very relevant connection point between our work and the current crisis is money. So the money that we spend or have spent and will spend on nukes in the name of our supposed security has hamstrung us. It's prevented us from spending on actual priorities like public health preparedness. And now everyone is seeing this. It's not a new refrain for us. It's something that we've worked on quite extensively, and really talking about opportunity costs has been central. But this is a moment to help more people understand that and to take action.
Great. Thank you very much. Let's turn our attention for a moment to the foreign policy aspect of the coronavirus crisis. And John Carl, let me turn to you. I mean, we now have this maximum pressure campaign, happening with U.S. policy towards Iran and North Korea. And so people are now starting to say that this might not be a great idea in terms of helping those countries deal with coronavirus. And in fact, we have the United Nations Human Rights Commissioner saying that we should be rethinking sanctions in the age of corona. Give us your thoughts on how U.S. policy on North Korea and Iran should be rethought in this new time.
Sure. Well, I think the important thing to remember is that maximum pressure has been the major way that the Trump administration has designed and pursued to try to get these countries to behave the way the Trump administration wants them to behave. And now we're faced with a point where maximum pressure could actually be worsening the global health environment because it's exacerbating all of the effects of the pandemic in these particular countries, which kind of, so when the Trump administration does this, it kind of undermines the very idea that they're pressuring these governments so that they'll be nicer to their people, because it's ordinary people who are bearing the brunt of the coronavirus outbreak. And one of the points I make in a new piece for the National Interest is that not only is this bad for the people of those countries, it's also bad for Americans, because the point that the UN High Commissioner on Human Rights was making, Michelle Bachelet, the point she was making was that there is no distant, elsewhere, far away, some other place that isn't going to be impacted in a pandemic. Our actions elsewhere are going to have blowback that could potentially impact us. And so our pursuit of maximum pressure out there is not only bad for the people in those countries, it's bad for people here, because it's a dereliction of our duty to public health.
So tell me a little more about that, because I don't think really Americans fully understand that the kind of steps we're taking to prevent other countries, in this case particularly Iran and North Korea, to get all the resources they need to battle the virus could in fact boomerang against Americans in the not too distant future. Can you walk us through how that might work?
Sure. The issue with the sanctions regime is that it makes it extremely complicated for any sort of aid to get into the country without a huge bureaucratic rigmarole. It makes it extremely difficult for the people in those countries to purchase the supplies that they need to actually fight the health outbreak. And in a country like North Korea, and Iran is very similar, the public health infrastructure is already not very good. In North Korea, it's almost non-existent. And so the potential for an outbreak, if there is one, to spiral out of control is huge. And pandemics aren't stopped by borders as much as President Trump might think they are. They could get out of control and start impacting other countries nearby. In the case of North Korea, that's countries like China and South Korea. In South Korea, you literally have 28,500 U.S. troops stationed there. There's many other Americans in South Korea. So there's potential for an outbreak in these countries to spiral out of control and start impacting Americans as well.
Thank you. There are the sirens. I want to thank both Cecili and John Carl Baker for joining us today. Stay socially distant, stay healthy, and we'll see you again soon.
We're talking today with Liz Watson, the director of the Congressional Progressive Caucus Center. Liz formerly worked as counsel to the House Education and Labor Committee and was the executive director of the Georgetown Center on Poverty and Inequality and the director of the Workplace Justice Program at the National Women's Law Center. In 2018, she ran for Congress in Indiana's 9th District on a bold, progressive, grassroots-led agenda. Liz, thank you so much for joining us today.
Joe, thank you so much for having me on.
And as our listeners probably have guessed, you're in your home, I'm in my home. Let me just first ask you, how are you doing? How are you coping with the pandemic and social distancing? You have small children, right? How are they coping?
Well, I have a 9 and 13-year-old, and today was the start in earnest of distance learning out here in Montgomery County, which is just outside DC. And so, we were trying to treat it like a back to school day. I don't know that we've been all that successful so far. Trying to have your kids, participate in school that you're supervising while you work a full-time job is its own special challenge. But, we know that our family is just, our challenge is really pale in comparison to what our frontline healthcare workers are facing, what our grocery store workers are facing, our package handlers. I just, as we were sitting here getting ready, Joe, I saw that 130,000 Macy's employees around the country are now being laid off, and Amazon workers are walking out in New York City, warehouse workers. So this is a really difficult time for so many people. And it's just, to be able to play a small part in trying to help deliver relief for people who are suffering. Honestly, I think our whole family feels, like that is the thing that we can do. Just to keep it real for a second. And I will say that nobody has made out in the time of coronavirus like dogs. I think they're the only ones, they're the only ones who are getting along, because some of them at least have their owners at home teleworking. So you might hear a little bark from Hoagie now and then, and he's just going to be saying hello.
Thank you. Well, thank you for describing that. And thank you very much for putting that all in perspective. We want to talk to you about what the Progressive Caucus Center has been doing, particularly on this relief bill. But first, can you just describe the center and what you do overall?
Sure. So I came to the Congressional Progressive Caucus Center a little over a year ago, and the role of the center is to connect think tanks, grassroots activist organizations, and folks who develop policy, so that we can make sure that we are moving ideas forward that are actually responding to the needs of real people. And we know, of course, in Washington that there's plenty of groups that are out there representing Wall Street and the banking industry and, trade associations, making sure that the needs of the corporate elite are well represented. Something that we do here at the center is provide the infrastructure for the progressive movement to think about how we can make change at the federal level. And so we are often talking to federal policymakers, to members of Congress, and folks who can advance change in the Congress. And we're also connecting in really closely through some structures that we have, like a Policy and Research Council, a Labor Council, and a movement table with nearly 100 progressive organizations with these different parts of the movement that can help to lift up and amplify the best ideas to move progressive reforms forward. So that's a little bit about what we do.
And how does this relate to the Congressional Progressive Caucus?
So let me tell you about the Congressional Progressive Caucus. So that is a body in Congress that is nearly 100 members strong. The co-chairs of the Progressive Caucus are Congresswoman Pramila Jayapal. She's from Washington, which has been so hard hit, the state of Washington, and Congressman Mark Pocan from Wisconsin. The Progressive Caucus grew by over 20 members in the last cycle and has really become an incredibly strong force within the Congress, ensuring that the ideas that are being put forward in the Congress are actually representing folks on the ground and the needs of communities. So we at the Congressional Progressive Caucus Center are frequently communicating with policymakers, including members of the Progressive Caucus, and really working to make sure that we are advancing the best ideas that we can to our policymakers and to our Congress.
And full disclosure, we at Plowshares Fund awarded the center a grant earlier this year, which in conjunction with a couple of other foundations is allowing you to hire a national security staffer. You've been building up the staff since you came on as executive director, right?
That's right. And so we're now at about 10 staff, and we have 6 fellows who are placed in congressional offices on the Hill.
Great. Well, tell us about the legislative process, particularly what just happened last week. It's amazing. We passed a $2 trillion economic relief package, and there's not a word about it in Monday's papers. It seems to have completely disappeared. It's hard to imagine we can pass the largest economic relief package ever in the history of the United States, and already it's yesterday's news. But tell us about the good, the bad, and the ugly in this bill.
Sure. What we saw the Progressive Caucus do was on March 19th, they led a letter to Speaker Pelosi. They led a letter saying, this is what we would like to see in the third relief package. This is what we think is important, right? They really laid out a very clear-eyed set of progressive priorities to deliver real relief to real people in terms of free testing and treatment, cash assistance payments to happen monthly until the economy recovers. The need to make sure that worker-centered aid has a lot of conditionality on it, meaning it's not just a bailout for industry, to support small businesses and nonprofits, to broadly expand our unemployment insurance system, and a lot more provisions, paid sick days expansion, and making sure immigrants are included. And then what happened? Pelosi put a marker bill out that was really actually quite strong, and it included a number of these really important priorities, and you could see what the letter that progressives had written just absolutely reflected in the Pelosi marker bill. So I thought that was a really important step on the road to success. But then you get to the fact that there's a divided Congress, right? So the question was, how much of this did the Senate pick up in the CARES Act, right? And the $2 trillion bill that got passed. You all might remember that the House, many of them are scattered to the winds, making it very hard to actually go back and forth in a deliberative way on this legislation. So we basically had, an up or down vote on the Senate.
How much of the things that you wanted do you think we got from this bill? And how much do we have to swallow? How much was relief for people like most of us, and how much was corporate giveaways?
Look, there's no question this bill delivers real relief. It dramatically expands unemployment insurance, $600 extra a week on top of whatever people's benefits payments would be. It extends unemployment for an additional 13 weeks on top of what people would get. It provides big relief to small business owners, which is so badly needed. It provides relief to our states to support the provision of essential services. It provides these one-time cash assistance grants. I'm not too impressed with one-time payments. I think we need a lot more. Provides relief to childcare providers and folks who need to continue receiving childcare, and for housing, and $100 million for the Bureau of Prisons for coronavirus prevention, and $850 million for the Burn Justice Association grants to law enforcement. So these are big numbers. The real, where the rubber meets the road and the real problem in this piece of legislation is that it did not have sufficient guardrails for industry. And you're going to see progressives come out very loudly on that issue, and you already are. And so, and as we all should. So what am I talking about here? So we had a huge amount of aid to industry that was in this piece of legislation, right? And that aid doesn't have enough restrictions in terms of making sure that employers don't lay off their workers. So specifically, when we look at the $450 billion for industry, there's a huge ability to game the system for employers to take that money and then there's the potential to continue laying people off anyway. So that's something we're incredibly concerned about. We are concerned about the oversight provisions that were in the legislation, right? Because how those provisions get implemented and how they get strengthened in a fourth package that we are really going to be fighting for is the name of the game. But in general, we made a lot of, we really did make a lot of important gains here in this legislation for people. But I'd love to talk with you about what we need to do next.
Good. That's exactly where I want to go. And, everybody who's worked in Congress understands the need for compromise. You never get everything you want. Well, sometimes they get everything they want. But it's rare that you get a piece of legislation that is as good as you wanted it to be. So, but you're, in general, you're sort of happy with the compromise?
I'm not happy with the giveaways to corporations without guardrails. I'm not happy with that at all. But I am happy that people who are out of work will get a meaningful amount of unemployment assistance. I am happy, right, that the earlier bill provided paid sick days to some. I'm not happy that it wasn't to all. I am happy that there was provisions around nutrition assistance and childcare and these other things that people need. But it didn't go far enough, right? And that's, I think, what we need to talk about.
So where do we go next? What happens next? Is there going to be another relief bill? And how are you and the Progressive Caucus Center going to be working that? Yeah.
So I believe that we all need to start advocating right now to ensure that there will be a next relief package. Clearly, the American people need more relief, and we need to make sure that Congress provides it. I think for that to happen, we all have to fight for it. So when we think about, well, what else is needed? What else is there, right? I think that this piece of legislation did not do enough to prevent layoffs, and that's really, really important. I think it did not do enough to secure the safety of the American people, and that means safety of our frontline workers in terms of having any sort of standards for the masks and personal protective equipment they're wearing. It means safety in terms of making sure that people can stay home and get paid when they're sick, right? And so far, we've only covered 20% of the workforce with that. So it didn't do enough in terms of layoff prevention. It didn't do enough in terms of safety. And it didn't do enough in terms of making testing and treatment free for everyone, regardless of immigration status. Because certainly the coronavirus does not discriminate, right, in terms of immigration status. And so our relief can't either. And the fact is, I think what really has become clear out of all of this is that we're all in this together, and we all pay the price when we treat people like they don't matter. And so we are paying the price for years and years and years of disinvestment in the American people. And that is what our government has consistently been doing. And so I think for folks in the progressive community, we are seeing exactly what happens when we have a country that does not guarantee affordable healthcare coverage to everyone. We have people who are not going to get tested. We have people who won't get treated, right? We have people who are afraid to go in for testing and treatment because of their immigration status, right? Because of the way in which this country has vilified immigrants. We have people who are incurring greater expenses right now, right? Trying to go out to their jobs as healthcare first responders and at the grocery store, but their kids are home and they have to pay for childcare assistance, and because they earn poverty wages, as so many people who work in those kind of industries do, they can't afford childcare, right? So this is definitely a chickens come home to roost moment, and we need to do better, and we need to do it now if we're going to actually, as folks say, flatten the curve and really stop ourselves from having a social and economic crisis at catastrophic levels.
I completely agree. What do you think you're going to be doing over the next few weeks, and months, to advocate for this? How does it actually work?
Mm-hmm. So one of the things that we do as a hub for the progressive movement is we bring together the best thinkers and movement activists to really put together clear sets of priorities. And so we're already meeting with our friends in the progressive community who have been doing a lot of thinking about how it is that we actually put in place real guardrails on industry, that we hold corporations accountable, that we prevent layoffs, right? Folks in the union world, folks in the economic think tank sphere, folks in the grassroots sphere. And we're meeting with them and working with them to make sure that the package that we advocate for as a community really boils down to what is most essential right now. Because as progressives, we love to have a Christmas tree, right? And we like to throw everything on it and put all the ornaments, and it looks fabulous. But the reality is right now, we need to get our ducks in a row about what needs to be in that fourth package and make a clearly articulated set of goals and priorities. So we're working with our friends right now to do that. We're throwing a meeting together today with the progressive community to take our first cut.
Wow, great. Tell me, we are early in this crisis. I think over the next 2 weeks, the death toll is going to rise, the number of cases are going to rise, the economic dislocation is going to get even more severe, and we will still, at the end of 2 weeks, be in the early phases of this. So it's hard to say how this is going to change our views of, say, what national security really means. But people are beginning to talk about this, that this, as you say, the chickens have come home to roost. We understand what it means that we've been chronically disinvesting in America and putting the resources in places that seem so remote now. Do we really need to buy more F-35s? Is that really what's going to keep Americans safe? Do we have to spend $100 billion on a new intercontinental ballistic missile, or $50 billion next year on nuclear weapons? These are kind of big questions that we haven't even looked at yet. Do you see any of these coming up in the discussions? And specifically, do you think there's any possibility we might revisit the top line number that we're going to spend on Pentagon programs next year, which has been set at $750 billion? So at a time where we're spending all this money for the pandemic, for economic relief, is there any possibility we might decide to reprogram some of that what we used to call national security funding, the National Security Authorization Act, that we might decide that some of that money needs to be moved to other more pressing needs here at home?
I think we absolutely should. As you probably know, the president has invoked the Defense Production Act and is talking and has just started with GM actually working on ordering the production of ventilators. And we know that we need ventilators, we need masks, we need other personal protective equipment. And we have all these hospitals all over the country who are suffering. I spent my whole weekend working on this issue. And this is a little bit of an underreported issue in some ways, because honestly, if we don't solve this problem right now, we have the potential to have what happened in Spain, where 12% of the cases are healthcare workers. If we have a healthcare workforce shortage, who is going to take care of folks when they go into the hospitals? And so we need to make sure that we get the right equipment into the hospitals, that we get the protections for the people working there, right? We're spending all this money on our military. Why did we not have a national stockpile that had that stuff there in the first place, right? Because we were not prioritizing the right things. And so I think we do need a reprioritization. I think we absolutely should not be building up our military weapons when, at the expense of our public health infrastructure. But that is what we've done for years. And so I think it is time to revisit that. I think one of the things that's clear here is that this is a global crisis. It's a crisis that does not respect borders. It doesn't. And we have to understand that if we are going to deal with this crisis effectively, that's going to mean actually working with our global partners and not alienating and isolating them. So I think the isolationist tendencies of this administration are absolutely counter to our ability to recover, to respond effectively. And right now, that is exactly what we need, is to actually become a global partner who steps up.
Yeah, I'm actually writing an article on Secretary of State Mike Pompeo and his insistence on using the phrase Wuhan virus in the G7 joint statement, which none of our allies would agree to. And therefore, there was not a G7 summit statement at a time when you need global cooperation. Here's our Secretary of State killing global cooperations for what is essentially a racist, I think, white nationalist whistle. It's really unbelievable how incompetent our leadership is at the top level.
I think if we had been in a better posture globally, with the countries that in other administrations we would regard as our partners, we wouldn't have been so behind the curve, because we would have had more information about what was happening and what was coming, and we would have been paying attention, right? And looking at what other countries were doing. But in a America First isolationist posture, we don't have an administration that looks to other countries for advice and counsel. And that right now, we're seeing, as we've just eclipsed every other country in the world, for the most cases over the weekend, we're seeing the effects of that.
Yeah, there's tremendous uncertainty about what's about to happen. For example, some of our colleagues have been talking to the House Armed Services Committee, and they are set to mark up the bill in April and take it to the floor in May, but it's not clear that timetable is going to continue. It's not clear that when or how the Congress is going to come back. How is this kind of uncertainty affecting you? You say you're still having your movement discussions. Are you still having your congressional discussions?
So we have our movement table has gone online, and thank God for technology. Can you imagine if all of this was happening without Zoom and everything else? And so we are continuing to do that. We do from time to time invite members of Congress to be special guests and participate in those meetings. Certainly, the members of Congress across the country, I know that they are still working and fighting hard, particularly progressives, for a fourth relief package, and thinking about what that should look like. Tonight, actually, we're hosting a little plug. Tonight, we're hosting a Facebook Live, which folks can also listen to later, with Congresswoman Pramila Jayapal from Washington State, talking about her, and we're going to ask her some questions about her views of the relief that's been provided so far and what she thinks needs to happen next.
Good. So we're almost out of time here, but if people want to know more about the center, where can they go? Where can they find out about you? And are there any, I think you've put out a series of updates on the coronavirus crisis. Can they subscribe to that? Tell us about where they can write for more information.
Great. So if you would like to stay updated, you can join our email list, and you just send a note to info@Progressive Caucus Center. It's long. info@progressivecaucuscenter.org. And if you would like to find updates on our website, you can go to progressivecaucuscenter.org, where we have a set of coronavirus resources and are constantly updating them on the latest that is happening at the federal level on coronavirus response.
Great. Well, Liz, I'm so glad you are where you are and that you're doing what you're doing and that you found time to talk to us about it today. Thank you very much for joining us.
Well, it's great to be here with you, Joe. Thank you. Bye-bye.
Thanks for listening to Press the Button. This podcast is produced by Delphine Vigil, Zach Brown, Derek Sender, Alex Spire, and Will Lowry. Sound design by Derek Sender. Audio engineering by Derek Sender and Will Lowry. Research by Alex Spire. Our theme song is by Lyrics Born and the Poets of Rhythm, sampled with kind permission. Additional music by San Francisco-based bands 17 Evergreen and the Society of Rockets. To continue the dialogue and support our work, visit plowshares.org.